there's this story that's gone viral, literally, and it was in Chimtai Gowin's story earlier on as our top story. The former KPA staffer, James Oyugi, who traveled all the way from Mombasa through Nairobi to Siaya and then died from COVID-19.
That's right.
You
and
can see
that
the pictures on the
viral
screen.
video right there is of his burial. Rather unceremonious, Jeff, especially when you're talking about a community in Siaya. They take burying their dead very, very seriously. And so a lot of people have been complaining about how this is anti-cultural, very inhumane. It's a shallow grave, no coffin. So many wondering, what is the process? We know the government did say 24 hours to bury any COVID-19 victim. But is there a way to do this?
And by the way, Victoria, this happened in the dead of night.
Right.
Let's not forget, dead of night, people wailing in the background. So we're going to go right now live on the phone and speak to Chief Government Pathologist, Dr. Johansen Odour. Dr. Odour, if you can hear us, it's Jeff and Vicky on Sunday Live. Good evening, sir.
Evening to you too, Jeff.
Okay, so you've seen the pictures, as have millions of Kenyans, and it seems very, very unceremonial. Is this the new protocol that we're adopting?
I don't think is what we meant when we came up with the guidelines. Because what actually we meant is burying the body within 24 to 48 hours. But even when you're burying the body, cultural, religious, observations should be taken care of. According to our guidelines, we were very clear that the body should have 2 body bags, with the external one decontaminated. The body also should be put in a coffin, and the family has to be involved as much as possible in the whole ceremony.
Dr. Odour, you mentioned that there are 2 body bags, one to help with the decomposing of the body. Is there any embalming at all? Because when you look at that video, for instance, of course, a very shallow grave, when the body starts to decompose, yes, you have 2 body bags, but in that 24 hours, can there be any embalming to help with the decomposing?
We are discouraging embalming due to obvious reason, being that we don't want the body to be manipulated in any way. We are encouraging minimal exposure to the body because of the virus that they are carrying. So that is why the body has to be put in 2 body bags, and there is a decontamination. The grave should be the standard grave, which is about 6 feet here. Yes.
But Dr. Odour, if I can jump in there now, that grave did not seem like it was 6 feet, number one. Number 2, after a few days' time, it's obvious that there's going to be a stench in that area.
I haven't looked at the clip myself, so I'll not be able to talk about it. However, we usually have body bags which are designated for such bodies, and they are very specific. And they are body bags which are used in the field when they are also mass disasters. These body bags can keep a body for about 10 years, actually, the body bags which we talk about, yes.
So you're saying there's not going to be any smell, no stench in the next few days, few weeks?
I don't think so. Okay, what I'm saying is I've not seen the clip, but if they followed that was in the guideline, there'll be no smell, yes.
Now, Dr. Odour, of course, there's a whole process in how to bury and dispose of a COVID-19 victim's body. And you mentioned that you'd want to have families involved in this process as much as possible. How is this protocol being communicated to families? Because it is a very sensitive time. Are they being told how to go about this process? So, of course, no one is offended in the process.
The protocol has been communicated to the counties, and I think the public health officers are aware about it, and I think they should be the ones communicating to the family.
Yeah, but doctor, and you will see that video, you could hear people wailing in the background.
Yes.
And they seemed very helpless. There's nothing they could do. And the feeling is this is a very inhumane thing, if you will.
Yes.
Your thoughts?
What I'll advise the county and the people executing this guideline is they stick to it and they observe dignity, because as forensic practitioners, we really believe in dignity to the dead. They ensure that they involve the family as much as possible, and they also involve the religious people to at least pray for the departed soul.
All right. Thank you, Dr. Odour. That's all the time we have. And hopefully this protocol is actually followed. According to that video, they haven't followed at all what Dr. Odour has just mentioned.
Absolutely. Yeah. Hopefully there's a lesson learned somewhere there. Huh?
Absolutely.
Moving forward. Thanks, Dr. Johansen Odour, Chief Government Pathologist.